to Talking Women's Health, our podcast here at ABOG where we have candid conversations with amazing leaders in obstetrics and gynecology. Today, the topic of our conversation is going to be about the ACE pilot, which is an update and an innovation in our continuing certification program here at ABOG. I'm joined here by my colleagues, Dr. Kenneth Kim and Dr. Pooja Shivraj. Dr. Kim is the Chief of Medical Practice and Certification Innovation here at the board, and he's an Associate Executive Officer. Besides his efforts and work within innovation in assessment and certification, he's an actively practicing GYN oncologist, so he does the work that we assess in every day. And Dr. Pooja Shivraj, who is a Chief of Assessments. In addition to her work for ABOG, is also a nationally respected psychometrician with publications in the assessment field, not only within obstetrics and gynecology. So I have the perfect partners for this conversation today, so I'm really looking forward to the conversation. So I want to start by talking about ACE specifically. I know you're both very knowledgeable about the pilot. But specifically, I wanted to get some updates. Dr. Kim, maybe you can start and just tell me how the pilot's going and what you're seeing so far with it and where are there opportunities for improvement?
Yeah, so far the ACE pilot has been going really well. We've gotten a lot of positive feedback from the diplomates that have already done their CC, understanding that not every diplomate has done their CC or completed it, but lots of positive feedback. It really complements the article-based assessments that we have to add these knowledge gap assessments to better inform the diplomates as well as the field for anywhere that other societies might want to concentrate their educational efforts and programming.
So, Dr. Shivraj, I want to get your take, right? Since you're sort of an expert in the issues around assessment and evaluation. Part of the reason that we did this was to bring precision to our continuing certification. And the real reason behind that is so that we could focus and tailor the assessment around what somebody actually did in their practice, right? And make it practice relevant. Can you tell us a little bit about what you think the why is behind we're doing the ACE and really what you hope to achieve?
Absolutely. I think that's a great question. So just rewinding back a couple of years and why we implemented this, right? We had our article-based assessments, just like Dr. Kim mentioned, and we wanted sort of a partner product to go with our article-based assessments. We have these wonderful articles that keep our physicians up to date in the field. But we really needed something that assesses knowledge gaps. Our physicians choose articles that keep them up to date in the field that they want to choose, that they want to read. But there isn't really a place where they can understand where their knowledge gaps are within their practice. So what we wanted to do was create this place where they can personalize their assessments and find out where within their practice they can understand where their knowledge gaps are, but where it's sort of stress-free, where it's anxiety-free, where it's less burdensome for them. And so that was the product we were trying to create when we created ACE. So it felt less burdensome for them. We didn't want it to be scored when we created it. And that was the product we tried to create when we created ACE for them, the ACE pilot, and personalized it to their practice. So it wasn't just gaps in their knowledge or gaps across the breadth of the field. It was specific to their practice when we created it. And so that was the idea behind ACE.
As a practicing OBGYN, I take all of these assessments as well. And, one of the things that I know is that when I am choosing my articles, I'm choosing things that are of interest to me. But in some respects, I've been sort of an expert in some of those areas. And so it's really not helping me from a quality improvement perspective, understand where I actually have difficulties and where I've got a gap in knowledge. And it's, I think, so much more important for us to get to see these things sort of on paper and not actually face it in the interaction with the patient. Dr. Kim, can you say a little bit more about personalization? I don't think this is just our first foray in trying to, tailor our assessments in a way that are going to promote mastery in our diplomates.
Absolutely. We, in our continuing evolution to get to that precision education, so that our CCR continuing certification helps the diplomates without being overly burdensome to really personalize their ongoing lifelong learning. Like for me as a G1 oncologist, I don't need to probably be getting questions in obstetrics and things like that when I'm doing CC. I similarly choose articles that I'm interested in, but ACE is really great because those questions are developed by many of our subject matter experts who are practicing physicians in the field. And the intention of the ACE pilot and those items are to push towards mastery so that we can maintain those standards in practice across the field, whether it's obstetrics, gynecology, any of the subspecialties, and so on and so forth. So it's our first foray into being able to pick what practice they're in, but having items that are written by other subject matter experts to push towards mastery. And as you said, this is probably our first step into getting to increasingly more personalized education, but being mindful, especially as practicing diplomates, to not make it too burdensome as we take care of our patients day to day.
You know, it reminds me of another conversation that we've had recently, and that is about this idea that we think about continuing certification not just as a compliance requirement, but we think of it more as a philosophy. How do we show the diplomate where they have difficulties, and where do we make it easy for them to sort of fill that gap? And so it's I think a completely different take on where we're headed with continuing certification. Dr. Shivraj, do you want to elaborate on that at all?
Yeah, absolutely. In thinking about where we are actually headed, so I'll start with ACE, right? One of the things we haven't actually talked about within 2026, right, is this idea of spaced repetition, the spaced repetition model. So when you think about education and learning, this idea of when you get a question wrong, how do you actually learn from it, right? In 2027, when a physician gets a question wrong on ACE, the idea is they will get the question again because it's reinforcing that concept of learning, right? So whatever question they get wrong in 2026, you're trying to reinforce that learning by them getting that question again in order to help reinforce that concept again. But looking futuristically in ACE, you're having that assessment drive learning. So hopefully, when we get to a place, we will hopefully get to a place where when we find those gaps in knowledge with physicians, we may be able to push articles to them that will say, here are your gaps in knowledge. Here are the articles that support your gaps in knowledge. Instead of them picking the articles that they like, they can also pick the articles that they like, but here are also articles to support your learning. And that is where we're trying to head with that sort of education or learning with your gaps of knowledge. And hopefully that's the direction we'll be heading in.
So it's like kind of like a clinical quality improvement cycle at the individual level. And I think, Dr. Kim, you talked about our ability to take that same information in an aggregate and feed it to specialty and subspecialty societies like ACOG, in your case, SGO, any of the other subspecialty societies, so that they can work on that educational programming. It's something that's actually new and different for the field, but I think it should be important for our audience to understand that it's really new and different in the House of Medicine, not just for OBGYN. There's some others that have some longitudinal assessments. Ours has got some similarities, but some important distinctions. So let's talk about how we're doing. You've given us a little bit of insight in 2026. And so I know that part of 2026, what's planned is an evaluation. What's going to make ACE successful? Will we continue it into next year? So what are some of those things that we are doing to assess? Dr. Kim, if you want to start, and Dr. Shivraj, if you want to jump in. What are those things that we're doing to assess, and how will we feed that information back to our diplomates?
Well, firstly, the good thing is that we've had really very positive feedback for the program, the pilot so far. But certainly because this is a pilot, it's really critical that we get the feedback from the diplomates as they go through the questions, whether there are questions that, there's maybe multiple correct responses considering new research that has come out or things like that, or other suggestions for other topics that we want to add for items. So we take all of that diplomate feedback. We take it to heart, as you know, to try to improve things and look at 2.0. But all that feedback is important to us that we take into consideration.
Yeah, absolutely. So I think about it as when we designed ACE, we had designed it to a couple of pillars, right? We wanted it to assess knowledge gaps. We wanted it to be relevant to practice. We definitely wanted it to be anxiety free. We wanted it to be less burdensome for physicians. And those are the things we are measuring when we gave our diplomates surveys in between our ACE questions to ensure that is the goal we are trying to meet with our ACE, right? Our ACE pilot. It's not going to be perfect. It's a pilot. That's why it's a pilot. We know when we are personalizing it right now, we're not going to get to be perfect, right? We know the questions that we're giving them for ACE, they're not going to be exactly what we wanted it to be. And we're going to refine it as we go along in 2027 and get more precise as we go. So that is the goal, and we want diplomate feedback as we go through this process in order to get better and better over time. So we are looking at diplomate feedback that comes in through our contact us page, through our emails, and we do want as much feedback as we can get as we go through the year. So our surveys are one thing we are looking at. Our emails are another thing we are looking at. We won't be modifying the actual program too much as we get into 2027 because we do also want to look at how our spaced repetition works in 2027 and gather feedback through that before we make a full modification to our program and collect more data then in order to see how the actual pilot works to go into 2028.
So, you both have suggested that early feedback is particularly strong. Do you want to share any of that early feedback? For example, you raised the idea that you wanted it to be, low burden and low stress. What are some of the kinds of feedback that you're getting specifically as with regards to that intentionality that we had when the program was designed?
Do you want to go? Do you want me to go?
You want to start and I can jump in?
Absolutely. So early feedback has been pretty positive, I will say. The fact that we've reduced our number of articles to initially we had 120 questions. We reduced that to 60 and then balanced that out with our ACE questions, I think was a good idea. So we've gotten feedback that that has been helpful. The fact that we are not scoring it has been less anxiety provoking is what we're hearing. And we've also gotten a lot of feedback to get all the questions up front, the 60 questions. Like, can we please have the ACE questions all up front? We've gotten that feedback too. And so I think that is the feedback that we're getting. Anything else to add?
No, the people, the article-based assessments obviously are what comprise the 86% for the performance pathway to not take the Part 3 exam. And the fact that the ACE items are not graded is very, very popular and very, very positively received. Pooja's right. A lot of people just want all of their questions up front to get them all done. But overall, a lot of positive feedback about even the topics and the questions that are written and the degree. They're different from all the other questions that we have in our from initial certification, written exam, oral exam. These are specifically geared towards mastery of our field and the topics in our field and take some additional effort to write. But we've had good feedback even for the types of questions we've written as well.
And I will say we are appreciative of our physicians and diplomates who provide us feedback on how we can iterate over our ACE pilot and what modifications we can make. So definitely appreciative of that as well.
So what I'm hearing is ACE will continue into 2027. I'm also hearing that diplomates can expect spaced repetition. They'll get to see the questions that they missed again in 2027. I would also like to give a little bit of a shout out to our colleagues in IT that helped us design this system, because one of the things that we've universally heard is that the platform actually works really well. So that's great. But we expect to continue to study, do some tweaks, but it sounds like we'll probably move from a pilot phase to a production phase. Am I hearing that actually correctly?
That is correct, yes. And the other thing we didn't mention was that diplomates will get feedback at the end of the year on how they're doing as well. And we are in the process of looking at what feedback we can give them.
Well, that sounds great. So I think this has been an amazing update on the ACE pilot. It's been so nice to watch its gestation and its birth. And now we're going to see how it grows up and becomes a toddler. In the last couple of minutes of this podcast, you get to tell our diplomates or our listeners, whoever they may be, or candidates, anything that you want to sort of summarize where you think we're going with continuing certification or assessments in general. So, Dr. Kim, I'll start with you.
Yeah, kind of like we mentioned before, we really are trying to figure out how to evolve to that precision education to match each diplomate with the appropriate continuing certification type topics, materials, things like that, which could be a wide range of things. And certainly with part 4, there's a lot of opportunity for improvements as well there. So this is our first step into that personalization, and we're going to be working hard to keep that evolution ongoing. And any of their feedback is always helpful to us to help along the way. Certainly, if they'd like to volunteer with us, that is also always welcome.
Dr. Shivraj?
Yeah, I think continuing certification is an exciting space at this point in time. I am excited about the prospects of ACE. As a physician, I think the prospects for mastery are great. And as a patient myself, I feel like physicians who take ACE seriously, I would be confident going to a physician. I think the mastery aspect of it is wonderful, and I think we're moving in the right direction with ABOG implementing ACE. So just confidence, I think, is where I am with the ACE product and where ABOG is headed with continuing certification.
So let me see if I can summarize what you both told me in a different way. At ABOG, we listen to our diplomates. We hear their needs. And this particular initiative, or innovation in this case, the ACE pilot, is here to stay. We heard that our diplomates enjoy it. They want it to be, any process to be relevant and to be of value to them. They don't want to just do busy work. So we've heard that. We've implemented this process. And so ACE will move from a pilot to production with some tweaks over the coming year. So with that, I'd really like to conclude this episode of Talking Women's Health. I'd like to thank my wonderful guests for being here today, explaining the ins and outs of the ACE pilot, and I look forward to seeing you on future episodes of Talking Women's Health.